Hello, I'm Chad Briggs from the University of Alaska Anchorage. I'm honored today to be here with Trish Zornio. And Trish, if you could please introduce yourself.
Sure. Hi, everyone. My name is Trish. I work at the University of Colorado here, and I happen to be a neuroscience and research methodology instructor, and also have worked in what we call translational research. In addition to that, though, I actually happen to have worked for a little over 5 years now in policy research and development and translating that science actually into effective policy, both here in the state of Colorado and federally. So I am very happy to be here today and be able to hopefully lend some discussion for consideration.
Thanks. And we really needed, we had a discussion together, I think back at the end of March, about COVID and the response. And things have changed since then. I mean, it's been months, and I think both in our personal lives and I think everything around us. I mean, we're now in this position where the US really has among the highest per capita rates of COVID in the US, I mean, in the world, if not just the highest in terms of total. Where did we go wrong? I mean, if we look back in March, I think we were still even a little bit hopeful that we'd do the right things, and obviously we haven't.
Hopeful is a perpetual state that I have been in, I think, for many, many months now. You know, starting all the way back in December, January, from the scientific side, we started seeing the news come out in the research end, and we knew that there were steps that needed to be taken. And you and I had actually discussed this before. We were very concerned about the systematic defunding of the pandemic response teams and all sorts of things that had gone into place starting in 2017 under Trump. And then it did leave us a little bit exposed, but we were hopeful, at least, that maybe we would start having some increased responses, because it's certainly a global pandemic, and we wanted to make sure that we're protecting folks. Unfortunately, what we've seen, I think, is a continued disregard for that being a priority, and really focusing more on campaign strategies and really putting re-election bids and potential strategies there far over any sort of national strategy and coordination. And I think a really good example of that is the NRSC, so the National Republican Senatorial Committee, actually even came out, and part of their re-election strategy as of a couple months ago is to literally have their candidates start levying attacks against China, to have continued animosity there, and then make the Democrats look weak for election gains. And so you're seeing this sort of systematic anti-science sentiment. You're seeing that pushback on globalization and the need to address that from a global perspective, and a continued emphasis on re-election campaigns, much more so than we are seeing effective strategies for actually handling a pandemic. So, you know, when our highest federal leaders are not being consistent with really basic things like physical distancing and mask wearing, when you're seeing complete, you know, here in Colorado, we are such a national representative of what's happening, because we have some of the sort of most blue leading counties in the nation, and then we actually have some of what some people have referred to as the Trumpiest counties in the nation. And in fact, we have even some counties that have gone 98% plus in that 2016 election for support of him. And what we have is a part of Colorado that's abiding by these regulations, and then we have you know, another part of Colorado where we have even sheriffs or local officials that are refusing the governor's mandates, refusing to enact any sort of policy that's being put forth from a public health perspective. We have restaurants that are actually openly declaring and going national on Twitter for literally denying those health orders and still serving people without masks or any distancing, et cetera. And we're working to systematically shut them down, but you know, it's a real big problem. And actually a couple weeks ago, we even had a situation here in Colorado where a 2,000 person concert and rodeo without any enforcement of masks or distancing happened right here, you know, hour and a half from my house. And I think this is the kind of thing that we're seeing that Colorado is really exemplifying, unfortunately, because we are a very mixed state politically, that it's become not a science issue or any sort of policy issue, but it really has become a partisan issue. And that's stemming from a lot of things that came far before, I would argue, the actual COVID pandemic that we're currently in. I think these are symptoms that have been brewing for a long time.
Well, we could discuss this as a public health issue, and you know, my background is sort of in energy and environment, and you come at this as a neuroscientist. But are there ways that we can look at COVID not just as a medical issue, but also as an environmental issue?
Uh, do you mean environmental as related to climate change specifically, or other types of environmental issues? Because
Really,
there are actually many.
yeah, anything on the
Yeah.
spectrum.
Yeah. So, well, let's start with the environmental piece, because there was a really interesting study that came out from Stanford recently that sort of seeks to examine some of the underlying conditions that might have made America a little bit more prone to having some of the severe reactions to COVID and symptomology, and in some cases even elevate deaths. And so one of the things that we know from COVID is that when we have what's called a comorbidity, so that is an existing disease process, then those patients are significantly more likely to be impacted in both severity and or in death rates. And the Stanford study started making, from an environmental perspective, started making links between increased air pollution, having higher links with folks who then had comorbidities, whether that was hypertension or diabetes or respiratory, et cetera, and finding that those communities were actually disproportionately impacted by COVID because they were already susceptible. And those communities do tend to be in minorities, and they tend to be even some low SES socioeconomic status communities. And so we're seeing disproportional impact there. The other thing is that the US actually does have some of the higher rates of comorbidities already, so it's hard to tease that out. But they were making pretty clear links with some of that air pollution and some of the environmental considerations that go along with that. On the climate change side, I'm more fascinated personally in the idea that we have a situation where one urgent crisis has now been replaced by another. It is almost more immediate. And I think I'm concerned by watching a lot of the resources that should have been going to address climate change, our debt budgets and all these sorts of things, they're not going to be able to go toward climate change. They're going to be now toward COVID and alleviating the massive economic impact that we've had for millions of Americans losing jobs and so on. And so I think it's going to be significantly harder to build back. And we are both having to work past this immediate crisis. And I think that's a really interesting tie between COVID and sort of that environmental security component, because it's hard to address two major crises at the same time.
Yeah, and we've seen that not just with climate change, but a number of the natural hazards, like new tsunami risks we're trying to deal with in Alaska, and we just don't have the oxygen in the room to deal with more than one thing at a time.
Yeah. Yeah, and we're dealing with that in Colorado right now. We have a number of really major fires actually that are going on, and it's actually displacing people in the midst of COVID, right? So there's another situation where you have increased, because of climate change, we do have, increased dramatic wildfires that we didn't used to have in the same kind of way here. And so it's actually, putting people out in a situation where they're not supposed to be around others. And so they're actually having to seek out and then intermingle with folks that they're not supposed to be intermingling with, and obviously crossing over distancing thresholds, et cetera. And so, it's just something that compounds, and you can't ever isolate issues like this. It's something that you have to always consider in tandem. But I do think that the resource issue is going to be the biggest thing that we face.
Well, and one aspect that I've been looking at it from was also the security angle. And I know this is what we discussed back in March. And there were really interesting stories that came out. I mean, obviously everyone knew about the Theodore Roosevelt. And this was one of the traditional approaches to security, is to look at force protection, meaning the service members and making sure that they don't get sick because it affects readiness. But you've just written recently about the idea of vaccine nationalism.
Yeah.
And especially given the news today of Russia announcing that they've come up with a vaccine. Yeah,
this is something that we've never really seen before. This, American culture, because you can't disentangle the fact that we are not a collective culture in the same way as other nations, right? So we are an independent, very freedom-based sort of culture. And so you can't completely disentangle that, but we've certainly never had this extreme level of nationalism coming out, and particularly tied to the idea that we actually haven't even, we're one of the only nations, in fact, that is working on vaccine development that has not offered that if we achieve a vaccine, that we will bring that forward for public good. And this is a really detrimental component, because, and the piece that I am writing that's coming out tomorrow is actually all about how it's bad enough and unwise enough to pursue a nationalistic approach when it comes to a vaccine development. Vaccines require everything from the research to the production everything in between from material gathering and manufacturing. It's a billion-dollar enterprise that requires regional cooperation at an immense level that even some of the materials can only be secured from certain parts of the world. And so it has to be a global cooperation. And then for the speed component with COVID, there's just no way to do it effectively without that cooperation. And so, when you're starting in that kind of place and you choose to still elect a nationalistic strategy, that's bad enough. The problem is that we actually exacerbated the nationalistic approach here in America because, so from the biomedical side, a number of scientists actually brought up this concern very early on when Operation Warp Speed was coming out through the Trump administration. And scientists warned that we were not diversifying our technologies. And what they were talking about is that currently today, there are 8 primary vaccine technologies that we could potentially leverage that were existing in basic research and also in previously approved kind of technologies in vaccine development. And China is actually the only nation who has worked to diversify their technological approach. And in fact, of the 8 vaccines that are currently in a phase 3, which is the furthest along, closest to potential approval level, 4 of those 8 are coming in from China. And in fact, they have diversified at least across 2 techniques in those initial candidates. And they have worked off of existing techniques. America, however, only has 1 of those 8. And we've only put 1 technology forth. And more importantly, that technology is actually not tried and true. So we are putting forth a novel genetic technology that has never actually, to the best of my knowledge, been proven in anything beyond basic research to date. And so what that means is that it's kind of like, it's almost like not diversifying your financial portfolio and accepting the increased risk that you take. And you're hoping for that really big payoff. But unfortunately, we have no way of knowing which strategy is going to be most effective from a scientific side in terms of vaccine development. A vast majority of studies that get to phase 3 do not actually meet clinical standards. And to address that, what we've seen is the FDA actually reduced the efficacy. So not safety and efficacy are 2 very different things. So not safety reduction, but a reduction in the efficacy required for the vaccine. It only now needs to meet a 50%, meaning 1 in 2 people would have a vaccine that is effective. So then you have obviously 50% of the people that get the vaccine, it is not effective. And so we have really put all our eggs in one basket, and it's a very risky gamble because this is a geopolitical concern in terms of national standing, and we're not willing to collaborate. We're not willing to, potentially, we sent very strong messages that we're not willing to work with most nations effectively anyway. It's kind of lip service at best. And more than that, we actually really do, going back to that initial component, we have a party here in the US that is actively provoking the one nation that is likely to be leading on that vaccine development. And it's really putting us at a risk potentially to be able to even access that vaccine early on. And our scientists here could be scrambling to kind of catch up when that vaccine is released to try to replicate it. Because while there's a lot of shared information in public publications and such, it's not going to be a perfect recipe that comes in, right? So there could definitely be delay there. It can be everything from economic and geopolitical ramifications. And this vaccine nationalism is fascinating because the US has never been one to pursue something like that in the past in any sort of nationalistic strategy, let alone for something like a global pandemic. So from a scientific side, as it's coming into the policy and the national security, it's fascinating. I'd love to hear kind of your thoughts from the expertise that you have on these topics.
Well, it's interesting because we also have the cyber component, meaning there have been cyber attacks on pharmaceutical companies,
Yep.
and including by Russia trying to steal some of the research that China and the US have done. Yeah, sort of saying that this is our product and we're only going to give it to certain people really doesn't, I don't know, it just doesn't equate from a public health point. Because you need as many people as possible to get the best vaccine possible, especially given that this is a really tricky virus, meaning the herd immunity, we don't know what it really is. We don't know what's needed for the body for antibodies in order to achieve that sort of immunity. And so you really need to sort of cover the spread in terms of gambling for what's going to work. And yeah, to say that we're going to do one untested technology and we're not going to accept anything from anyone else. And even this one accepted technology, I mean, who's going to receive it in the U.S., even if it does work? Is it just going to be a select group of people?
Yeah.
You know,
Well,
is it going to be
that's
like
the
$1,000 treatment that you have to sort of pay in cash and get on the list? And
all very, very good questions. And unfortunately, there were, I don't know if you saw them, there were some recent polls that came out that showed in some of them as little as 50% of Americans would be willing to accept a vaccine coming out at any time in the near future. And I think, you know, this is really a strong sentiment to the longstanding, that's why I was saying, you know, this is really a little bit more of a symptom in some senses, because it's these sort of ideologies of everything is fake news, everything is, you know, some based on some sort of disinformation campaign, vaccines aren't real, or, you know, I've heard it all. I've actually had people come up to me in the hospital and straight up tell me I'm part of a government conspiracy while I'm drawing their blood. And I thought, if you really think that, why are you letting me draw your blood? You know, but I think, you know, so I don't think that these are true beliefs at the end of the day, because certainly if somebody really believed I was part of a government conspiracy, they wouldn't come to me willingly and ask me to draw their blood. But I do think that we are in a situation where people are not really evaluating the information that they get very critically and just sort of parrot what they find. And I think it's really playing out in terms of, even if we had a vaccine, America might be poised more than most other nations in similar situations to not actually accept that vaccine, or at least not accept it for some period of time. And I think these sorts of things are really, really interesting when you get down to it. The other component here is the manufacturing and the actual rampant production that needs to happen so quickly. And I think that, again, in and of itself, even if we, in a best case scenario, are one vaccine technology that was largely untested in clinical capacities, let's say that it works. That's great. But to be able to produce the quantities that we need, we don't necessarily know what materials that would require. We don't necessarily know, you know, which facilities that require. They might be broad. It's going to be very difficult for a nation to want to say, well, yes, we are happy to produce this for you, even if you don't give us any, right? Like, that's really unlikely. And so I think even if we were to identify one, we then hit the next sticking parts of not being willing to collaborate effectively. And one of the things I've been reminding people is that the administration that we do elect in November will likely be overseeing that manufacturing and distributing process and decide whether or not we work toward global collaborations or not. And that's a huge component.
yeah, that is a really important component of the election. And you know, there may even be reasons for people to discount and sort of wonder if a vaccine is workable, because I mean, obviously you know, if I were in Moscow right now and someone's saying, hey, take this vaccine, I would sort of look at the Russian vaccine and say, well, I'm really not sure, because it really seems more like a political ploy, and it's not even in the phase 3 trials yet. And likewise, if the White House just the week before the November election says, hey, we've come up with the vaccine now, we've come up with the cure, there are a lot of people who would look at it and go, well, are you sure? You know, is this just a political statement?
Yeah, and there are some good reasons to be concerned, right? I think hydroxychloroquine under the Trump administration is a really good example of pressure that was put for an EUA, which really should not, and then later had to be revoked because it was a very thin authorization use to begin with. And I think most scientists did not support that decision, and yet we saw it go through anyway because there was some political pressure that was applied. And so I think I'm really hoping, again, hope is really the perpetual state here. I'm really hoping that we've again learned that lesson, and I think at the same time we would be remiss to acknowledge, to overlook rather, that there aren't some potential concerns to consider. And I think this is actually true not just for a vaccine in Russia or China or really anywhere, because of the geopolitical forces that are at nature here, and that push to really be first, because there is going to be a benefit for the nation that achieves that. And by first, I don't just mean the first approved vaccine. I mean the first commercially available approved vaccine that is able for wide distribution. That's a very different sort of category. Technically, there are 2 vaccines that are quote unquote approved. China has one for the military authorization, and then Russia this morning, of course, came out and said that they have one. But like you mentioned, those are not in the same trial phases of safety and efficacy that we would largely see, and it's certainly not recommended for commercial use yet. And I think one of the things that we have to consider from the trial side is that because of those forces that are coming in potentially in terms of wanting to be first, it would really behoove us worldwide to actually make sure that those vaccines are being tested in multiple countries, and in part just because of resources. So to be able to reach, say, 30,000 patients, which is a lot of the time the case for, say, a phase 3 approval, which is ultimately required for FDA here, to be able to hit 30,000 that quickly, you really do need to leverage as many hospitals and sites as you can and staff accordingly. And so here in the US, we are by far one of the best set up for that kind of infrastructure in terms of existing researchers and hospitals and clinics that are used to these kinds of protocols. We do this a lot. We have bittersweet access to high infected population. We have access to things that other parts of the world actually don't right now. And our collaboration would also have given us actually better access to the data and better access to make sure that it's quality data. And then it would also give us the opportunity to ensure that those clinical trials were being collected and conducted in an ethical sort of way. And so I think these are the kinds of concerns that by adopting this nationalism approach, we are foregoing the ability to actually engage successfully. And it's probably going to produce a lower quality early vaccine to begin with, because most likely, and I think this gets lost a lot, the first vaccine is not going to be the end all be all. And in fact, the first vaccine is unlikely to be the best vaccine. And so we'll have continued development that needs to happen and continued partnerships that should be ongoing. And to stay out of that process, both early on and continued, would be really to the detriment of Americans. So I think this is a very complex example of what happens, not just with anti-science rhetoric, but also with anti-globalization efforts.
And it's not even necessary. I mean, we can we can impose sanctions on Russian banks and financiers and still cooperate with the Russian Space Agency.
Yes,
and there's a very long history of that sort of cooperation.
Yeah, and the same sort of thing that we're seeing with China. So, we don't have to accept every single thing that's being done by a nation, but unnecessarily provoking that nation at the same time. Just this morning, Trump again, I think he tweeted out something about the China plague again. These are the kinds of things that, it's really not helpful in actually undercutting any sort of successful relationships. And particularly when that nation is one of the leading in the potential solutions, it's just a bad idea. I can't believe I have to actually say that aloud, but that is a bad idea. So.
Well, and close to home, I could ask, I mean, we're both educators and
Yeah.
we're looking at the new fall semester starting.
I know, next week, for me anyway.
Yeah, and of course the University of Alaska Anchorage, it's pretty much closed down. I mean, aside from some vocational programs, and certainly with my programs, we made that decision pretty early on, I didn't figure that the US was going to be quite ready, but are we ready? I mean, there's all this discussion about how the US should go back to school and how we see all these photos coming out of high schools in Georgia, and are we really ready for that?
Yeah, I mean, so I think, again, this is a situation where, and I kind of wrote a little bit of a harsh sentiment actually on this, where I said, basically, we can't talk about sending people back to school until adults start following the rules. And what I meant by that was really something so simple, that other nations are actually getting to the point where they are able to address this, because not only have they flattened the curve, but they have flattened the curve successfully enough where the active rate of infections is decreasing, not increasing. And so we call this an R value. And so there's sort of a level at which you can watch and you say, well, if you're under 1, an R1, if you're able to get it down there, then you don't see those active infections spreading. And we knew that in flatten the curve, there were likely, just based on human predictive abilities of what we do, we knew that there were likely to be sort of little humps along the way. What we didn't expect was that, there's no way to model leadership that doesn't actually take into account a lot of this stuff. And so what we didn't expect, that the second peak would rise so quickly, so early on, because we were expecting it a little bit later in the fall. And of course, now we're already in a second peak and have been for quite some time. And some states are doing better than others, but as a nation at large, we're not doing particularly well. So when we talk about going back to school, it's incredibly difficult when you have active caseloads that are increasing, because at the end of the day, this is really about a resource issue. And so whether or not children are necessarily susceptible to severe symptoms of the disease or even death is actually almost a secondary, because we know that they don't seem to be affected in the same capacities as adults. But what we do know is that there is still a potential, because of the science in real time, we're still trying to figure this out, there's still a pretty strong indicator that they can be carriers. And when you're talking about already having actively increasing infections, and you're talking about thousands of children going back into schools, not just alone, but with teachers, with principals, with parents around, right? This is not happening in isolation. Then you start rapidly increasing that infection rate on top of the already increase that was the increase that was already happening, rather. And then you get in a situation where you're actually exceeding those capacities very quickly in terms of hospital resources, et cetera. And so this is really an issue unique to America, because there are a lot of studies. It's very clear we should be trying to send children back to school as quickly as possible. We know that there are long-term detrimental effects, and in fact, some of those effects have already been seen, even just from missing the one semester and or a handful of months in the year from COVID already. So we know we need to get children back, but we can't do it until we can do it safely, and until we start actually bringing down that curve successfully. We just can't even really have that conversation without risking exceeding our resource capacity. And so I think, again, just America is really not doing very well in terms of addressing the needs at large and prioritizing. We're very freedom-based. Too many people are making this a political issue instead of a science issue.
Yeah, unfortunately.
Yeah.
I will say it's a little weird in Alaska, because Alaska is very much freedom-loving. If any state in the union sort of prides itself on that and being libertarian, but at the same time, it has very deep memories of past pandemics. And
Okay.
I think that you see the governor's office sort of trying to cut it both ways sometimes, but
Okay.
and it differs from town to town, industry to industry, but for the most part, I've sort of been surprised here, and pleasantly, and have to thank the local city and my university chancellor for showing leadership on their own. But it is really problematic when you have individual leadership. It's each town, each state has to have its own leadership, and we're not just sort of following some sort of national leadership to tackle this issue, really.
Yeah, I mean, this really has to come from a coordinated effort. It's, back in March when we were talking about the lack of a coordinated effort. I think at the time we were talking about, the fact that we were not enacting in full the DPA, the Defense Production Act. We were talking about all these efforts for testing and tracing that just, weren't being followed through, and ventilator production, et cetera. And so I think that sentiment, the exact specifics have changed a little bit, but the sentiment is still remaining at large, right? There just has not been a coordinated, hard push from the federal leadership to make sure that we are making this a priority and working to systematically flatten that curve and keep it flat, right? That is the challenge, because I think, unfortunately, early on, and there was a lot of discussion in the scientific communities and likely in yours as well, we knew this wasn't, once it passed containment status, the best pandemic response is actually prevention. But once you pass that and containment is no longer possible, or at least not feasible, then you get into a situation where it's not going to be a short-term problem, right? So we knew early on, I said initially probably a 3 to 5 year kind of thing, because I knew the vaccine developments and how long they took, and not just how long they would take to create, but also deploy, right? Because you have to reach that herd immunity status and actually get those logistics out. And speaking of which, would love to hear your thoughts on this. So I have mixed feelings about, so the Trump administration came out and said that part of the deployment plan was going to be to leverage the federal troops, actually, and the military. And I thought, well, on the one hand, from a logistical standpoint, there is a potential role for a military involvement here, not from active military being placed, but from the logistics perspective behind the scenes. However, with what we've seen in Portland and other cities, particularly in urban left-leaning cities, I worry that going into the election cycle, particularly, this could be used as a cover for sort of vaccine deployment that is actually more voters submission, sort of suppression, or any sort of other number of concerns here. And so I'm kind of curious, did you see that? And do you share these concerns, or is that just me?
Well, it's a deep-seated fear. I mean, if you remember back to the old X-Files episodes and movies, it was FEMA that was secretly going to be in control of everything. Right. And here it is that the new proposal is that unemployment insurance money will come from the disaster budget, just as we're going into what the National Weather Service calls heightened hurricane season. meaning we've already had a few storms and we're going to have a bunch more. And yeah, it's problematic because if you just sort of drop the ball on one thing and you say, well, we're not going to use the Defense Production Act for these because, you know, we're just going to let the market go. But for this, we definitely need to use troops. It really sends a mixed message, and you're not really sure exactly, well, what the strategy is. You know, what is it that's trying to be accomplished? And yes, given what we've seen in Portland and other cities, then it does also have people raise questions about, well, what's really the strategy here? What really is the goal that's trying to be accomplished? And there have been stories that have come out that, yeah, Kushner, when sort of faced with the initial pandemic, was just saying, well, it doesn't politically make sense for us to address the pandemic on a national scale because it's mostly affecting blue states. And you know, that really undercuts any sort of confidence that people have on any subsequent response. So even if you have Dr. Fauci, who maybe does step back in and has a lot of influence, but there's always going to be some sort of suspect response about, well, what's really the motivation behind that, and why is the government really doing that? And that's squandering a lot of potential goodwill that, you know, would have been there from the beginning. And I mean, just as a political scientist, I could say that, you know, the president could have taken other actions that would have benefited him greatly, politically speaking. But instead wanted to focus just on, okay, his base and the sort of reaction of, you know, let's be against China, like you said, which ended up not really helping anyone. It didn't help him politically. It didn't help the country in terms of an organized response. And, you know, looking at this, it's just not I mean, we can always say this isn't a rational political action, but we haven't been in that space for a long time. So it also means that when people look at other political actions, they're not going to assume any sort of rationality behind it unless it's conspiratorial. And that really hurts us politically. So even going into the next administration, there's going to be a lot of ill will towards certain agencies that for a long time have had very good reputations. I mean, CDC, for example, it's going to take a long time for them to rebuild their reputation. And that was completely needless because they were the world's best.
I've been thinking about this a lot, actually. You know, even if we are able to re-steer our path, right, and sort of navigate a different direction, do we have precedent here in the U.S.? Like, I have trouble thinking of some that, you know, how long is it going to take really for us to start building that trust again? I imagine it's going to be a very, very long time, even despite good intents from a new administration. I don't see that happening overnight. Do we have, can you think of other examples where something like the CDC has had to rebuild? I've been struggling to come up with some comparisons that really reflect.
Well, I do remember, because I was working in the federal government in early 2009. And I remember even working internationally that, and of course, people can look back fondly on the George W. Bush administration, you know, by comparison. But there was a lot of work to be done. I mean, even our closest allies, our closest friends abroad, you know, we had to go there physically. And this is another hurdle because we can't do that right now. We're not allowed to travel anymore. But, you know, it took physically going to places and saying, look, we understand, okay, you know, we're interested now. We're serious. We want to cooperate. And even then, you know, it took a while. There was a lot of opportunity there. There was a lot of openness, but you can't take your friends for granted. And so even our allies abroad, or the near abroad, like Canada, you can't take that for granted, because there's going to be ill will there. There's going to be ill will within the United States in different communities. And when you come back to issues like climate change, one of the things we said, even back in 2009, was we don't know if we have enough time to develop the trust we need to get these policies passed. And now it's just gone again. And that's really going to set us back. So it's not even just what you said before about the resources being gone, or the you know, people worried about the pandemic rather than climate change. Politically speaking, we're in a very different place than we were just a short while ago. And that leaves us less able to deal with these sorts of larger supranational problems that really require a lot of cooperation and trust in science.
Absolutely, absolutely. You know, I think the hard part is that scientists, whether they're in the climate space or whether they're now in epidemiology and other areas. Actually, when COVID first hit, there was sort of a running joke where the climate scientists were welcoming epidemiologists and saying, it's okay, we know how you feel. We've been here for decades, and we understand what it's like to get that anti-science pushback because they've been dealing with it for a long time. And I think, you know, I'm really hoping that we can use COVID under a new administration, hopefully, as an example of why leadership really does matter and why leveraging science, and you know, science isn't perfect by any sort of means, but it's certainly using the best evidence at any given time is certainly a better principle than working off any sort of belief systems or others. And so I'm really hoping that we can see some of that reestablish sentiment towards science coming back and support for it. But to be honest, I'm not particularly hopeful because, and the other side of this is that, you know, it's easy to kind of pin this on political forces or any number of certain leaders or candidates. But I think really the scientific community actually needs to reflect inward and look at how we have been systematically disengaging from political discourse. And we actually are not doing our best to bring that science to fruition and build those bridges with both policymakers and with the public, actually, because we know that has to be, that public side of science has to be really strong. And so we actually haven't done particularly well. And one of the things that I hope to see start developing is collaborations between policymakers and those scientists, both at institutions that are government-based, but also at academic institutions. And I think this is something we don't see. You know, right now, tenure, for example, tenure is based on reaching certain numbers of published studies, on, you know, any number of teaching requirements, et cetera. It's really not based on taking that science in any sort of public translation. And these are the sorts of things that as an institution, as a body, we can actually start considering and redress in the way that might make some sense to make changes to improve that sentiment and trust moving forward. Because to have no public facing component required at all for anyone in your departments can become a really difficult thing to overcome after many decades, as we're now seeing. So
yeah, for young academics, it's a liability if they do that. You know, public outreach is.
I mean, as you know, when I ran for the U.S. Senate, I actually had to, first of all, get off of federal dollars because the grants that I had been working on were federally based, and there was concern over whether or not that could be perceived as a Hatch Act violation. Hatch Act is typically applied for something else, but technically in wording, it might have carried over. And so I was advised just get out. And also, you know, the universities were actually very concerned that if I was actively criticizing the administration in charge, that they could just withdraw these millions of dollars in funds. You know, at the time I had been helping to co-lead an $8.2 million study. And you know, that was a big concern that maybe we would actually see that funding just disappear overnight. And so, you know, I think there are a lot of reasons that scientists do not engage. And I have learned a lot of them personally, but I also see some really tangible things that we could do to overcome some of those steps.
Well, one last thing I want to ask for anyone watching, are there good sources you could recommend out on the internet or anywhere where people could go for information about COVID or about the pandemic?
Yeah, you know, so one of the things that I really just always encourage people to do, and I'm assuming since this is a class through academic institutions, that hopefully people have access to, you know, the literature sources and libraries where they can go directly to sources and not rely necessarily quite so heavily on the internet Googling search. That's one of the biggest things, you know, looking for those .govs, looking for the .edus, but then really just going to the source and taking the time to read some of these papers that are coming out and make collaborative discussions with colleagues and really try to integrate that information, particularly interdisciplinary, because more and more these issues are branching out from one field of study. And I think you and I discussing today is a really good example of that, where the background that you bring is very different from the background that I come from, and yet there's still a lot of relationship there in how they start to interact, because we are more and more connected than ever before. So yeah, I would really strongly encourage looking for those, you know, CDC, the World Health Organization. You're looking to follow So Johns Hopkins has a fantastic tracker. Actually, even the New York Times has a really good vaccine tracker in terms of development. So if you're interested in following the vaccine developments and the technologies and stuff, they actually have a pretty good one. But really just going to that source and working with library staff, et cetera, is needed. That's always my strong recommendation. Read the studies.
Yeah, and thank you so much. I'm hoping that we can do another one of these in a couple months, and then by then we'll say, oh yeah, we're already past this. And now
I wonder if I'll be perpetually hopeful still, or if it will actually have been realized.
And we'll do a time lapse of what Trish looks like in every video.
Oh gosh, I haven't even cut my hair since at least the beginning of this year or something. So yeah, it's great to be able to interact with folks. I work at home. I have a cat cafe because I have a cat. So I've decided I live and work in a cat cafe, and it's we're adjusting like so many others.
Yeah. Well, thank you so much for your time.
Absolutely. Thank you.